When the COVID-19 pandemic hit Scotland more than 3 years ago, it went on to test the nation in ways which were almost unimaginable. And few aspects of our lives were left untouched. The Scottish COVID inquiry, which is investigating how the Holyrood government handled the crisis, has now launched a website inviting us all to share our personal experiences. The aim is to try and establish facts and lessons to be learned. We assessed what the inquiry might achieve with the health journalist Pennie and the junior doctor Lailah, who is the deputy chair of BMA Scotland. Pennie, there's a UK inquiry already underway. Is this any different? What's different about it?
Well, it's Scotland's independent inquiry into COVID-19. It's going to look very much at the decisions that were taken here, the response and the reaction in Scotland. The UK inquiry will carry on and also look across the piece, but this looks at how we did and what we did and what perhaps we could have done differently right here. And did we do much different in Scotland from the rest of the UK?
Well, I think... Timing was certainly different, but did we actually do anything different?
Well, it'll be down to, you know, when did we find out that actually we had cases here? I think there was a conference in Edinburgh, very early days. It'll be looking at how that was handled. And then it will be looking at, for instance, the decisions that were taken to move people out of hospitals and, say, into care homes, which we now know was a real cause of spread of COVID. Obviously, looking at these things with hindsight perhaps is easy, but I think the biggest questions are, what lessons do we need to learn to prepare ourselves for what might come next?
OK, well, we'll come to that a wee bit further down the line. But Lailah, what was it like on the front line during the pandemic?
I mean, I had a very different experience perhaps to some other doctors that are working in A&E. We had some good days and some bad days to some extent. When lockdown hit, sort of the numbers that were coming through our door did seem to drop off quite a lot. But actually, the patients that we were seeing were quite often in a really bad way. And so you'd sort of have a really lovely day compared to a really awful day, and you just didn't know what you were going to see next. And I think the fear and anxiety amongst us all of sort of not knowing what was around the corner, what was going to happen in half an hour, a week, a month. I don't think lots of us have still even processed that even now.
And this inquiry is seeking public experience, and I'll ask Pennie about that momentarily, but what would you, as a medic, tell the inquiry? I think I would definitely want to know that we are more prepared for the next pandemic, because we know that there will be another. Hopefully it won't be quite the same magnitude and quite the same impact, but I think we need to make sure that we're better prepared. I think the scary thing for me as a doctor was that I didn't feel that we were prepared. We felt like we were going into the unknown, not just because it was an unknown disease, but because it was unknown in terms of all the processes that were going on around us and how everything kept changing repeatedly. And I think we need to make sure that we learn from that, and also make sure that we have the NHS in a much healthier state. We'd just come out of the worst winter ever and then went straight into the pandemic that none of us had ever seen before. I think we need to make sure that the NHS is on a better footing so that we are better prepared for this sort of thing if it should happen, that we've got more resilience in the entire system, really. And Pennie, today's appeal was for public experience. So what do you think they might hear? What are they expecting to hear? And will people engage?
Well, there are three questions really being asked. One is, what was your experience of COVID? The next one is, what was the impact on you and the people you know of COVID? And the third question, what should we learn from it? So there are three straightforward questions. And I know of all those people who couldn't be with their loved ones as they died, for instance, who were not allowed to go into care homes to visit relatives. So many examples of the human impact. And I think that's what the inquiry needs to hear. What was the effect on everyone in their own homes around the country, as well as the effect on hospitals and our social care system. There are so many lessons to be learned.
And you think the public will engage with it?
Oh yeah, I think they will. I think there's a lot of trauma still out there among people who had really terrible times, and they need to be heard. And I think it's a really good thing that this is being set up to allow them to do that. My concern would be, what do they do with that information? If they get several million stories, how will they marshal them? But I assume they've got that one worked out.
Are there any obvious mistakes, Pennie, that are clear already before any inquiry even starts?
Well, I think it's difficult to talk about mistakes, given that, as Lailah has described, we were dealing with a situation. I mean, if you look back, and to try and remember back, I'm sure, it's just, I find it breathtaking to remember what we went through. But I think I'm with Lailah very much that why weren't we prepared? We have known since 1918 and the Great Spanish Flu that there was going to be another pandemic coming. They just happened cyclically. They have happened in other parts of the world. We've had SARS and MERS. Why did we never think they could come here? Was there complacency? For me, that's a very big question that has to be answered.
And Lailah, you and Pennie have both spoken about being prepared. What would preparation look like? What would that have been ideally?
I mean, there's a whole range of things. You know, you could talk probably for hours about it, but I think for me, lots of it was just, it felt like everything was an afterthought. Just simple things like higher protection PPE. There wasn't enough of it available. We had to keep being tested. And actually, none of us had really been tested in making sure that it fit us until the pandemic had hit. Why wasn't that just an automatic thing that was done? You know, I work in A&E. There's no reason that someone couldn't have come in with an infectious disease at any given point, but we weren't prepared for that. So I think it's just really simple things, just making sure that we are all better prepared, whether that be in terms of equipment, training, just all the contingency planning, just to make sure that we aren't in that same situation again.
Okay.
There are disaster scenarios for planes falling out of the sky, for nuclear power stations blowing up. Why not for an inevitability like a pandemic?
But could we have known, you know, a plane falling out of the sky, we know what that is. We know what a nuclear meltdown is. But could we have known what this was going to be?
We know very well what pandemics do. We have had the horrendous experience after the First World War that actually claimed more lives than were lost in the trenches at that time. I mean, in people's family histories, there'll be stories being told of having lost people to that pandemic. And as I say, around the world, there have been others. Have we taken the attitude, oh, well, it's happening over there, it's not happening here, it can't come here? Well, one of the things that I think the COVID-19 pandemic showed us is just how small the world is and how something can happen on the other side of it, and within 24 hours, it's in your territory. There have to be plans for that, because with climate change, there are predictions that pandemics are going to be even more common than they are now around the world.
And Lailah, we're talking about what went wrong, but of course, under the pressure of all that happened, a lot was got right eventually as well, was there not?
Yeah, I think for me, one of the biggest things that I think has been a benefit of working through the pandemic is I think there is a much more awareness of considering people's well-being, and, you know, a greater look at simple things like facilities that we have in order to take our breaks, and sort of the additional facilities that were put in the acute phase of the pandemic, and the speed at which they were put in was fantastic. And I think lots of those have been dialed back now, but it's really great to see those conversations being had to go, right, that worked really well. How can we put that in place? And I think really that's something that I'd like to see happening moving forward, is making sure that every member of the team is valued for the role that they're playing, and the work that they're inputting.
And Pennie, just finally, when would you expect to hear a report from this inquiry, and what might that be?
It's going to be a very long time. The inquiry in Scotland has had a slow start. There was a bump at the end of last year when the chair and several of the legal counsel resigned. It's good to see that they're getting work underway, but they're going to start taking formal evidence later on this year, and there will be a great deal of that to take. So I would imagine it's you know, don't hold your breath right now for the outcomes,
okay,
but it will be very interesting to see what's considered.
Pennie, Lailah, thank you both for joining us tonight.